information that we are sharing today is our own personal experience and does not constitute as medical advice. We do not endorse any products or services. Any said products or services mentioned on this podcast may not be suited for you or your condition. Please consult your physician before making any medical decisions. Today's episode is sponsored by the Wolfen Chair in Digital Health. The Can Do study, a Canada-Netherlands network in precision medicine in childhood arthritis and rheumatic disease, will allow doctors and families to quickly know who needs biologics, which biologics works best for their individual child, and when can the biologic be safely stopped.
Canadian and Dutch physician researchers formed an alliance, Can Do, together with patient and industry representatives and policymakers to develop the first genomics-based, low-cost biomarker blood test to rapidly identify the best treatment for each individual child, completely transforming the care of childhood arthritis. More about how they want to achieve this will be featured in future episodes. Hey everyone, welcome back to Take a Pain Check. We're really happy to introduce this week's guest, Dr. Michelle Battiche. Dr. Battiche graduated from medical school at the University of Toronto and completed her pediatric residency and pediatric rheumatology fellowship at the Hospital for Sick Children. She's currently practicing at McMaster Children's Hospital and the head of division for rheumatology in the Department of Pediatrics at McMaster University. Her clinical and research interests are in the transition to adult care for youth with chronic rheumatic diseases and is currently examining the impact of a parent toolkit to help youth through the transition process. So hi, Dr. Battiche. We're super excited to have you on today. And can you kind of start off with a little introduction about yourself?
Sure. So thank you both for having me on today. I'm really excited to be chatting with you over the next little bit about some of the work we've been doing here. So as you said, I've been working at McMaster as a pediatric rheumatologist for about 8 years now. And when I first started, there had been some transition clinics already running in our hospital, but they were only happening, twice a year. And over the past few years, we've really expanded that program where right now we're running clinics almost every other week with adult rheumatologists. So, that program has really expanded clinically. And then because of that, we really wanted to, focus on some interesting research questions about how our patients are doing through transition. And so that research program's also expanded quite a bit over the past few years. So it's been really exciting looking at transition here at MAC.
Mm-hmm. So where did your interest in rheumatic disease actually come from?
It started in medical school. As you rotate through, during your training, you rotate through all the different specialties. And I quickly realized that there wasn't one specific organ or body part that I really wanted to focus on. And when we rotated through rheumatology, I realized that it really spans almost every part of the body. So almost any organ can get involved in rheumatic conditions. So I really liked that aspect of it. And then I also liked working with children. And so, I did some extra, we call them electives, extra training blocks in pediatric rheumatology. And I thought this is the perfect fit for me. Mm-hmm. I almost think of rheumatology as like making puzzles, and it's not a clear cut, like you do one test and you have your diagnosis. So, we have to put a lot of pieces of the puzzle together to come up with an overlying diagnosis in rheumatology. So that part really attracts me. And there's, a lot of time to think about, think through patients and their conditions. So that part also is really attractive.
Yeah, that makes sense. I feel like that whole puzzle comparison is actually really true. And we can see that because we are patients with arthritis. So it definitely makes sense. It isn't so simple, I'd say, to kind of get to where we have to be. And you did mention transition. And I talked to someone before, we were doing a little discussion. And she mentioned that she transitioned from McMaster Children's Hospital, and everyone's experience in transition was very bad except for hers. And everyone was shocked. I'm not even kidding. Everyone was like, where did you transition from? Why does it sound so good? And so in terms of that, why do you think transition to adult care is really important and having that support is really important? And why did you kind of come up with this program that is occurring in your hospital?
Right. So I know exactly who you're talking about in terms of who you probably were chatting with. And yeah, when, again, just throughout working with youth and I'm seeing them go through that transition, at least the medical transition, you realize that there's more than just that's going on in any 17, 18, 19-year-olds lives, right? So you have all the typical things that you guys these youth are transitioning through, right? They're graduating high school, they're probably starting, university, college, or a new job. They may be moving out of their parents' home, and getting a car. So there's so many new transitions that they're going through outside of their own chronic illness. And then you add on top this other change that they're going through, changing hospitals, changing doctors, teams, taking care of their own medications, having to deal with prescriptions and insurance maybe. So there's a lot that they're going through. And then there's other types of transitions, relationships are starting to develop, and, dealing with, employers and your boss. And so there's so much that youth have the potential to struggle through during this time of their lives. And so when we saw that, and we thought, we need to better support these youth and their parents as well through this challenging, few years, because it's not just a one point in time. I think that's a key thing, right? So transition is not just this one time of transfer, today I'm your doctor and tomorrow so-and-so is your doctor. It's definitely a period of time where a lot is happening. And so I think it's essential that we best support them across all facets of their life, not just the medical aspects too.
Yeah. I mean, I had an okay transition, I would say. I did get lucky with my adult rheumatologist in Toronto. They're kind of difficult to find, at least good ones. So I got lucky on that aspect, but I found it was exactly like you had said. It was just a stop and start. And so, yes, all my notes had been faxed over, but what I find with my adult rheumatologist now that my pediatric rheumatologist did do is that there is actually no relationship between my rheumatologist and I. Whereas my pediatric rheumatologist and I would talk about anything and everything. And like, if I needed birth control, or if I needed something else, she'd be there and she'd be like, okay, like this makes sense to go on with your medication. And I remember the first time I ever asked my adult rheumatologist for it, she's like, that's not my department. You have to ask your family doctor. And I'm like, so you mean now I have to go running to 4 different doctors for 4 different things? And so I'm like, I'm really glad at least someone's doing it, as much as it's not it didn't happen where I was. Where did your passion in this kind of come?
I think it was just through my clinical experience in seeing seeing youth struggle through, just like you said, I need birth control, or how do I manage if I want to get pregnant in whatever number of years? Like, is this going to be okay? What do I have to do? Or, I'm starting university and my high school was great. They gave me a laptop. I had extra time for exams. How do I manage that now at university? And so being able to link them through the different departments within the university to help students with issues like this. So I think, there's so much we could do to help them. It's definitely not just the physician, but you need nursing support, your physiotherapist, the adult rheumatologist, and other healthcare professionals to help the patient through all of those different aspects.
Yeah, that totally makes sense. And I don't, I haven't transitioned yet. And so I don't know how this is going to go, but I've heard many people's experiences and everyone's experience kind of differs. So I think just like having the right pediatric rheumatologist kind of bring you to transition and show you what it's like would be like very helpful. So hopefully I get that. But from your experience, what do you think patients actually found the most difficult in transitioning to adult care, and how has that really shaped what you're trying to do? Like, what is the most difficult thing that they've probably talked about or you've seen?
I think it'll depend on how or where the patient is in their transition period. So again, as I said, it's not just one point in time. So we really approach transition as starting at 14 years of age, even all the way through to your mid-20s almost. And so for the 14, 15-year-olds to start preparing them for transition, we may they may struggle with just being able to just talk to the doctor and nurse by themselves without having mom and dad answer all the questions. Right. And then, the next stage may be, well, why don't you do most of the appointment by yourself, and mom and dad or caregiver can wait in the waiting room. Slowly it's a stepwise approach. And then over time, it'll be, well, obviously knowing what your condition is and knowing what medications you need are you're taking and when you need more prescriptions, for example. So it's a gradual process. And I think patients can struggle at every stage of that.
How do you ensure a smooth transition?
As I said, it's a team approach. So there's a lot of us working with the patient and the parent for, a smooth transition. We have different tools that we use that we could talk about to help gain and understand what we call our self-management skills. So these are skills that a youth will need to develop to just take care of their health on their own as best as possible. And as I said, some of those skills can be just being able to talk to the healthcare providers by themselves. Other times it could be, going to the appointments by yourself, or booking your own appointment, putting it in your phone, and you're remembering when your next appointment is. So it may seem like little simple tasks, but for a 15, 16-year-old, that may be a pretty hard thing to do. For a 19, 20-year-old, it could be a pretty hard thing to do as well. So I think that the other key factor is not every 15-year-old is the same, and not every 19. So some 19-year-olds may be at the level of a 15-year-old when it comes to doing some things, and some 15-year-olds may be almost ready to transition because they may be very independent in some of their healthcare. So just being aware that not every youth is at the same stage of transition is really important as well. And then guiding them. And so we have different tools, as I said, that we use in our clinic to help guide them. And I think it's really important that they meet their adult rheumatologist before that final appointment is also important, so that the patients get to know them, and then they get to know the patients as well, so they can have some sort of a relationship before that kind of official transfer to adult care.
Yeah, I'm 18 and I don't book my own appointments. Neither do I my mom into the clinic. So I definitely, if you're watching this, it's probably going to be a struggle.
It is. Yeah.
I think a lot of the time, people or teenagers like myself, it's just so convenient to have your parents do things for you.
When I was 15, I used to do speaking engagement for this group called Youth Speak. Not 15, probably a little bit older, 17. And my mom used to tell me you can go around to schools and talk to people, but you can't book your own doctor's appointments. I was like, yeah, because it's scary to talk to the nurse on the phone. I don't want to.
Exactly.
It's not even it's scary for me. To me, it's just why do I have to do it when someone else can do it for me? And it's very convenient. But I feel you'll realize when you get there that it's not going to be as easy anymore. If I was to move out, which I'm not, but if I was moving out, then that definitely would have been more challenging, because then I would have to have a rheumatologist where I would be, and then go and see how that would work, do my medications myself. Very hard. But we talked about kind of how patients like myself rely on our parents a lot to kind of do everything in pediatric care. What do you think patients can do to optimize their own healthcare transition? You did mention a few things about for example, booking your own appointments and stuff like that. What do you think is one key thing that you think patients could do to optimize their transition?
So there's probably different things. And I think, again, depending on the stage you're in, there are different things you can do. And I think the key is to realize you're not on your own. So you have this team around you, including your caregivers and your healthcare providers, to help guide you through this process. And so it could be just simple first steps, maybe make some eye contact with the nurse when you come into the room and answer his or her questions. That's an easy first thing. Well, I say it's easy, but it may not be easy for some patients, right? And then our job is to help kind of push you, maybe push the limits a little, and almost force you to ask us the questions, So we, at very early age, will just almost without even unless you have a very strong feeling against it, we'll say, mom, dad, why don't you wait in the waiting room and we'll see, the patient by themselves first. Assuming they're comfortable with that. We wouldn't want to put anyone in an uncomfortable situation. And many times the patients love that because it takes away their decision in a way, right? Because it might be awkward as a kid to say, mom, dad, I don't need you, leave, way outside. So it's almost like normalizing it to say, you know what, we do this with all 15-year-olds or 14-year-olds or 18-year-olds, mom, dad, wait in the waiting room. We promise we're going to keep you informed, but let's talk to the patient first, get a sense of what's going on in their lives, how they're doing. And then we'll bring you in and we can have an open discussion about what your concerns may be and help you through it as well.
Yeah, my mom was very upset when I asked that question the first time.
Yeah, so you don't want to, feel like you're insulting your parents by saying, I don't want you in the room anymore. So by having us introduce that idea and saying, we do this with everyone, it's not personal. It helps the youth, be able to do it on their own.
Yeah.
Yeah. I think that like having a doctor or a nurse tell your parent that rather than you, because they might like be like, oh, like, what are you hiding from us? Or
exactly.
When you're literally not hiding anything and you probably hope that they were there.
Exactly.
What type of resources do you recommend to those that are transitioning to adult care?
So, there are a lot of different tools and that are available, and they're all great. I don't think there's one that's the best out there. I think every clinic may have a different toolkit that they use. I think it's important that the clinic use some sort of measure of self-management skills. So again, these are the skills that youth will need to obtain to take care of their health by themselves as much as possible. So, the one we use in our clinic is called the Transition Queue, and it's based out of an app, which is convenient as well because you can complete it yourself on your phone, either just before your appointment or in the waiting room while waiting to see the doctor. And you could track your scores over time, and then you can email us your results and so on. So it's a really great tool in that way. And it's a pretty simple questionnaire. There's 14 questions, and it's all about how much are you able to do on your own? And you just answer them as never, sometimes, or I always do this. And it's things like, I talk to the nurse by myself. I go to the appointments by myself. I pick up my own prescription. So it gets harder and harder. So we wouldn't expect a 15-year-old or even a 19-year-old to be able to get 100%. But what we want to see is improvement over time. And then how we use the answers that you provide us in clinic is we'll go through the questions together. And then you, with one of the healthcare providers, will pick one or two goals. So we'll look at the questions that are answered as never, for example, and we'll say, okay, let's pick one or two of these and see if we can work towards moving from never to sometimes for the next appointment. And then we'll talk about some strategies that you can do to try to gain that skill so that the next time we see you, that we hope that you can answer at least sometimes or even always. And then over time, we want, those scores to slowly improve over, the months to years that we see each other before you finally transition. And I think there's also a role to keep using these types of tools after transition. Many people just kind of do a hard stop. Once you leave and you're at the adult rheumatologist, we don't check those things anymore. But transition doesn't end when you're 18. I think, into your 20s, you still need some help and guidance picking up some of those skills. So it's important to continue looking at those questionnaires beyond 18 to make sure that you continue to improve and pick up new skills over the time.
The app really seems like it can do a lot. And I hope that a lot of people are using tools like this on their transition. I'd probably not be able to put anything down for the first try, but it's but you can definitely improve. Like you said, it's a long period of time, which is really good. And you're not kind of forced to okay, tomorrow is the day you have to do it now. And then you don't know what to do. And then you start complaining about how bad transition was. And I feel like there's so many tools that even rheumatologists and patients can use to kind of work together to have the best transition over a few years. And in terms of having those tools, do you also provide your patients with support group tools or resources, anything to kind of support them so they're not alone in general, not just for transition?
Yeah, so there are different ways of connecting youth to other youth. I think looking at advocacy programs across the country. So, Cassie and Friends is a great example where they have a great teen group. So that would be one example. So it depends on what the youth or our patients really want and need. The good thing about Cassie and Friends is they also have very local chapters, right? So if they just want someone, within their region, we could try connecting them that way. If they have a very specific need or request, we could think, well, who else do we see would be a good fit? And then we would get their permission and your permission to, exchange emails, let's say, and then you guys can start chatting that way. Or even the parents can start chatting, because we've done that before too, where it's the parent who wants some help. And so we connect them with another parent as well. So there are different ways. I think, most people obviously go through social media, and you probably all have your own, groups that way as well. So that's another way of connecting. So there are different ways that you can help find some contact.
Yeah. So since the pandemic has started, it's been difficult for patients to see their doctors, specifically those who have recently transitioned to adult care. How can those young adults make sure that their condition is under control?
Yeah, so it's definitely been a challenge. At the very beginning, when we moved all our clinics to virtual platforms, we wanted to make sure that we didn't lose touch with these youth who are going through transition. So we continued to run our transition clinics virtually. And so, just like the three of us are on the screen now, we would have the patient, the adult rheumatologist, and the pediatric rheumatologist all on one screen and staying in touch. One thing that we've done here as well is we have a specialized trained physiotherapist with advanced training, and she's been able to connect with our patients who've recently transitioned and with one particular adult rheumatologist, and she will actually call them a week before their appointment with the adult rheumatologist. And so far, patients really like it. So it's a one-on-one phone conversation, and she just checks in with how they're doing and if there are any specific issues that they've been struggling with. And it almost gives them an idea of what to expect for their next appointment. And so then she can, either in the moment help provide feedback or support them, or at the very least, let the adult rheumatologist know, hey, heads up, so-and-so who's coming next week is really struggling with methotrexate or school, whatever it may be. And so at least then the adult rheumatologist has an idea of what to expect and can provide them support. So I know a lot of the youth have really appreciated getting that phone call. And it's great because, again, you don't have to, it's not an extra visit, and it's easy enough to just pick up the phone and chat with that healthcare provider.
Yeah, I mean, my rheumatologist went on maternity leave, so I think I had one appointment with her during all of COVID, and now she's gone until next January. So we'll see how this goes.
Wait, what do you do? Like, do you just not do it? Like, who do you
There's
see?
another, there is a rheumatologist there, like a replacement rheumatologist, if I need to, but she's only gone 6 months rather than a year. So
Okay. So
we're just going to see if I can make it.
You can make it? Okay.
I'm sure you can reach out to that team, though, I obviously to get help. Hopefully you don't need it, but
when you do need it.
Yeah.
So I think it was the other day where I thought about this. I don't know why, but when you kind of enter a rheumatology clinic, you only think that it's all about JIA, because that's the condition you have. You don't even think that rheumatologists treat other lupus and stuff like that. I entered my rheumatology clinic and I'm just okay, everyone here probably has JIA, because I had JIA. And on that note and basis, you obviously treat tons of conditions. And how do you think they kind of they obviously differ a lot? How does your day-to-day life work where you see patients do they all have a certain condition on one day? Do you kind of mix it up?
So I think if you ask every rheumatologist, we may have very different approaches, and it depends on the size of your practice and so on. So in some clinics, in some places they may have specialty clinics where today is lupus day, tomorrow is JIA day, and then the next day is a grab bag of anything. At MAC, we just see everyone no matter what your condition is on any day. So it's not like we have specialty clinics. So it's great. And that's why I love rheumatology, because, at 9 o'clock, you're going to see your JIA patient, and at 9:30, it may be someone with lupus, and at 10, it may be someone with some completely other rare condition in rheumatology. So it keeps you on your toes, and they all have very different medical needs. But again, going back to transition, I think all the transition needs are the same, no matter what your condition may be. Okay. Again, it goes back to, no matter what diagnosis you have, you're still going to be able to, know how to talk to the doctor, make your own appointments, know your medications. I think it's important that they know what their condition is so that they can explain it to someone if they have to. So, if you can imagine having to talk to your boss about, I have lupus, and the boss, I have no idea what that is. You should be able to describe very briefly what that is and what medications, if you need to describe that, or what accommodations you may need. So, some key skills that you're going to need no matter what your diagnosis is. And then there's specific diagnosis issues that you may need to know.
Okay. So how has immersing yourself in this position helped you better understand the JIA and lupus community, as well as these other communities that are there?
Yeah, I think, again, it comes down to each condition, each group of patients probably have their own unique needs when it comes to their medical needs, right? Because one group may struggle with pain a lot more. Another group may struggle more with fatigue or headaches, or, trouble focusing, and, school performance issues. So just being able to know what those unique needs are across each group is important. And then also being aware that there's certain things that cross all groups that are the same. So I think it's important to be able to identify what those unique needs are first, and then also appreciate that, at a 17-year-old with JIA and a 17-year-old with lupus are probably still struggling with the typical 17-year-old issues, whether it's, school, boyfriend, girlfriends, relationships, applying for university, things like that.
Yeah. And just along the lines of research, because you are heavily involved in research, I've seen you in some meetings that I'm in the transition hub and stuff like that.
Yes.
And Cassie and friends and everything, you're very involved, which is great, because it's great to know that a pediatric rheumatologist is also so immersed in research. We know that you're currently examining the impacts of the parent toolkit. Can you kind of explain what the toolkit is and what tools that you were talking about before? Because
Sure.
that would be really helpful.
Yeah, getting involved in research and transition, when you look at what's out there, there's been so much focus, which is important, on helping the youth go through transition. And what we realize both within research and just in our day-to-day lives is that parents struggle too. So parents also need to transition through this process as well. They need to be able to let go as your child is slowly picking up these skills and doing things on their own. It's going to be hard for the parent sometimes to say, I guess I have to wait outside. I can't go in the room with you. Or, you should be able to know when your prescriptions are. I'm not going to just tell you. So we thought, we need to develop some tools to help the parents out as well. So we are studying right now this toolkit. And so what the toolkit is made of is basically a guide that we developed for parents. So that's why I have this with you. I'll show you this lovely little guide. And you know what, we developed this not just on our own. It's not this is what I think parents need. We put together some ideas. We spoke to parents about this. We got their feedback. At the hospital, we have a family council. So it's a group of parents from the hospital that are involved with different things that are going on in the hospital. So we showed it to them, got their feedback as well. And in the guide, it really just helps kind of explain, okay, what is transition? What is your role as a parent in transition? What can you do to help your child go through transition? And then some basic differences between what to expect between pediatric care and adult care, because they're very different worlds. So that's one piece of the toolkit. In addition, we have these, what we call tip sheets. So if you remember in the transition queue, we want to, do goal settings with the youth, right? So let's say today you want to work on making your own appointments, for example. Well, we have a tip sheets for how to help your child make their own appointments. So this way the parent can also help their child prepare for that particular goal. So we give them the tip sheets. And then we developed a roadmap that we give to the youth, but it's meant to be worked on together with the parent. And so this is just an old draft, but it goes through, it's like a roadmap here of different kind of groups of skills. So talking about self-management, talking about, advocating for yourself, lifestyle and behavior, like how do I approach alcohol and certain drugs and things like that. And so it helps the youth go through it, but with the parents' guidance as well. So we hope that, by providing this toolkit to the families, that we see some improvement in their self-management skills and how they feel about how the transition process is going.
So one of your publications titled, I'm going to get this wrong, Transition Readiness in Adolescents with Juvenile Idiopathic Arthritis and Childhood Onset Systematic Lupus Erythematosus.
Erythematosus, lupus, just call it lupus.
Talks about when young adults feel most comfortable transitioning. Can you talk a little bit more about those findings?
Yeah, so what we did is we looked at the transition Q answers and their scores of youth of different ages, so from 14 all the way to 18, just to get a set of baseline of where are patients at with how ready they are to transition. And among all those questions, what are they struggling with the most? And so what we found is that the scores tend to go up with age, which we would expect, because as you age and you mature, you hope that you are able to take on more of your healthcare. And then when looking through what are the more common challenges that our patients were struggling with, one was like seeing the doctor alone. And so that was really helpful because that's something we can work on in clinic and we can tackle that with our patients and parents, right? So that was really helpful information. Other skills that they were challenged with are things like making their own appointments or picking up your own prescriptions or getting yourself to your appointments. And again, I wouldn't expect a 15-year-old to be able to get to the appointments and pick up prescriptions by themselves. But, as you age and go through transition, you want to be able to at least help them figure out how they can do it. They may not have a car, they may not have their license, but at least they should feel responsible for being able to figure out how to do it. So even if it's, again, you don't have a car, but you say, Mom, Dad, I'm due. My refill for, methotrexate is due. Can you help me get to the pharmacy to pick it up? So those are things that we can help them with as well in clinic.
So there's so much progress, as we've seen with you, that has kind of being made in the medical field in regards to Kawasaki disease and GA and lupus. And how do you keep up with all of these medical advancements for your patients?
Great question. It's super hard. I think everyone struggles with that. And because there's so much new knowledge that's being generated, day to day, and so many new findings across so many different conditions that you need to keep up with. So, there's the traditional ways, go to conferences, although they've been quite virtual for the past year, but, try to, attend as many as you can, lectures, kind of the traditional methods, read journals and publications. But what's really been exciting in the past few years is a lot of new ways of keeping up with, through social media. A lot of people, I learn a lot just by, scrolling my Twitter account. Sometimes people post some really interesting new things. So that's one really neat way of keeping up as well. And then podcasts, as we're doing right now, that I've been involved with in other podcasts as well. I think that's another great way of keeping up with just new knowledge. And it's an easy way, right? You just turn it on as you're driving to work or you're going for a walk. It's a great way of just being able to take in some new information.
Yeah. And it's entertaining too. So it's not just a bunch of information. Like, I hope we're funny. So we always like to kind of end up with some advice and get some insight on some of the things that we talked about. So what would you kind of like patients and the general public to know about the work that is being done with arthritis and lupus that you think people may not know?
There's so much that is being looked at right now. It's really exciting. Rheumatology is still kind of a new-ish field compared to other fields. And so we're learning so much just day to day. Even, what I learned in my training is probably already outdated compared to what is out there now. And the work that's being done kind of spans, it's like such a broad field from, the genetics of lupus or JIA, all the way to, personalized medicine and being able to predict who is going to respond to what drug, so we can, recommend a specific agent for a specific patient. So there's so much being done looking at that. And then there's a lot of work on just the practical day-to-day issues that patients deal with, transition. How do you deal with pain? How are patients coping with their jobs, and things like that, and relationships? So, there's something out there for anyone who's interested in pursuing research, but also from a patient's point of view, so many different aspects of your lives are being looked at by researchers across the world.
Yeah. And I think, like Natasha and I always speak about this, that's kind of why we started this podcast, is that there are so many adult voices in the field of pediatric rheumatology. And, I often felt that my patient voice got kind of dulled out, whether it be parents or your rheumatologist or the nurses or whatever doctor was in the room, it kind of overtook you. And that's a big reason as to why we did start this podcast, that it's kind of to give, even if you're 25 and got diagnosed with RA, you still were young and you still kind of feel like a kid in that moment because everybody's telling you something different. And so to end it off, we'd like to ask you, what advice would you give to youth who are looking to be involved in patient research?
Yeah, so, just to go back to what you said, I think it's really important to know that we hear your voices and we want to hear your voices. There's been a huge improvement, I think, especially in research, to include the patient's voice or the family's voice in pediatric. Yeah. And it's really important to include them in the process. And, more and more with what we've been doing as well, we've been, including patients in how we develop research questions, to how do we develop certain tools that we want to use or what outcomes we want to measure. And so I think if you are interested in that as a patient, youth, to, reach out to your team wherever you are and see, are there opportunities locally to be involved? And that could be through youth councils within rheumatology or even within the hospital that you go to have your voice heard, or through, again, national advocacy groups like Cassie and Friends. There's another way of having your voice heard that way. So there are different ways. I think it's really important for you guys to get involved in research. There are different programs, again, that help train you to become more familiar, more comfortable with the research process as well. Because not everyone knows about how research is conducted in health. So there are different ways of gaining some of those skills. And so if you want to get involved, I totally think it's really important for you to get involved and reach out to your team, and they'll gladly, guide you and tell you where you can go to get involved.
Yeah, and I think I've really just realized that very recently. Like, I was diagnosed 5 years ago, but it was only till like last year where I realized that your patient voice actually matters. And if you reach out, like, you will get things to do. Like, I know I've reached out to you, Dr. Batiste, just to want to be involved with anything you're doing. And I'm telling every single patient out there that, like, you can definitely make an impact, even though, like, you might not have like a medical degree or something like that. Like, your opinion and experiences have so much like value in what researchers are doing, and they kind of like really need your help just to make sure that they're all kind of on the right track. And I think a lot of us don't know that. I just sidetracked like crazy.
That's okay. I think it's really important because, like, for an example, like, while we were developing this toolkit, like, we had a bunch of people around the table, doctors, nurses, et cetera, researchers, and we're kind of brainstorming, okay, what do we think youth need? I'm like, well, we're not youth with rheumatic conditions. So what do we know? Like, we think we know, but, we'll put some ideas on paper and then we're like, we show it to our family, our patients. Okay, are we on the right track here? Like, is this what you guys need? And we need that impact and that your voice. And it doesn't have to be in a formal kind of process, right? Like through councils and research, but even just in clinic, if your doc comes up to you and say, look, we're working on this, can I get your feedback on it? That's a great opportunity to provide some feedback and have your voice heard.
Thank you so much for coming on today, Dr. Batiste. We really appreciated having you on. I think You're the first pediatric rheumatologist we've managed to get on to our podcast. So we're really excited to have this perspective as well. And for everybody that's watching, please like, comment, subscribe to us, and we'll see you next week on Take a Pain Check.
Bye.
Bye. Thanks again.
Can't hide, 'cause growing pains are keeping me up.